coming up. Then we get you to stand up. When you stand up, the sympathetic nervous system should notice something happened, because all of a sudden now your muscles have to become, more tightened. You have to stand erect. Your eyes have to. We also turn on the lights. Your eyes have to constrict because we turned on the lights. Now your blood pressure has to work against gravity, so your blood pressure needs to increase. So you're supposed to get this little dip here. And the better your autonomic nervous system works, the deeper the decline, and the recovery should almost be back up to where you were when you were lying down. So your body makes all of these changes, and then now that you're standing up, you should go back into a resting state, okay? So you can do this, and you can divide this up. This is called a spectrum, and this is the parasympathetic nervous system. It's looking at the power of the parasympathetic nervous system. It's looking at the power of those long lines and the power of the short lines. So this is parasympathetic, this is adrenaline and the sympathetic nervous system, and this is cortisol right here. Now, if you look down here, I know you may not be able to see this, but this total power is probably the most important number here. This total power means what is the total power in the autonomic nervous system? It's adding all these up. And that should be at least, at the minimum, 1,000. In a nice, healthy person, it should be 4,000, 5,000, 6,000. Okay? We have somebody who was in our office who, I'll show it to you. Hers is 7,000. So it's looking at the power of your rest and digest and your power of your fight or flight. And fight or flight doesn't mean that you're running from a tiger or whatever. Our fight or flight is being able to get up at 7 o'clock and come to one of these meetings. Or it's, the fight or flight of getting your kids off to school. And that's what you see that a lot of your patients are complaining of. They don't have the energy to do just the regular daily activity. And you can see that in this heart rate variability. The great thing about this is that patients come in complaining of things, and you can show them objectively, yeah, this is what's happening. You don't have the power to get up and go. So this is a cortisol pattern. Cortisol, when you run out of neurotransmitters, you got to go to the cortisol system. Cortisol is a hormone. Neurotransmitters are in these little vesicles like this. They're quick on and quick off. Serotonin reuptake inhibitor slows down the reuptake of the serotonin because this is a quick on and off system, and they have to have that quick on and off system in order to make these quick changes. Cortisol is a hormone that starts in the morning and it ends in the evening. Cortisol is like that. So once cortisol is on, it doesn't turn off very quickly, and it also doesn't make any quick changes. So you see here, you would think that we didn't have this person stand up. But standing up to this person is such a minor stress that they're like, I'm not going to make any changes on that. I got bigger fish to fry. So this is a cortisol pattern. Even if you don't do a salivary test, this person has adrenal issues, just by looking at that. All right. So this is like a perfect one. This is the person who we took their HRV before they started working for us. Now, after we started working for us, we're not going to tell, I don't know how the HRV looked. Now, I'm going to tell you another thing that I've started doing. I started doing these on new employees. And I can tell you who's going to be a high-energy employee and who's going to be a low-energy employee. I'm about to make it as a part of my interview process. Like, yeah, you want a job? Could I get you to lay down and let me put this little strap on you? Because I'm going to tell you, it'll tell you. Okay, so now here's a perfect HRV. See all those short lines? It should look like uncut grass. It should look like grass you haven't cut in months. That is a normal HRV. Then when you stand up, your body should make all these changes. And then you see how even though she's standing up, it still looks like she's resting. That is a perfect HRV. You will probably see that 2 or 3 times a year. Am I right? Beg your pardon? If you're doing a lot of them, yeah, you have to do a lot of them to see this 2 or 3 times a year, okay? Try and get this. So again, this lady's, her total power is 7,000. The total power is 7,000. This is her parasympathetic when she's lying down. That makes sense. You should be resting and digesting when you lie down. So this is the power of her parasympathetic. This is the power of adrenaline, and this is the power of cortisol, okay? Then when she stands up, her parasympathetic goes down a little bit. The adrenaline goes down a little bit. It's the cortisol. So it's a little bit less power usually when they lie down because the parasympathetic goes down. I just want look at this one. This is what you see a lot. There's no variability at all. And just like in a baby when there's no variability, there's problems on the horizon. If you don't do anything, there's problems on the horizon. I'm going to talk about this a little bit, phosphatidylserine. I'm going to talk about this a little bit on the next lecture. I just want to get to one thing here. We can do adaptogens. Some more people are going to talk about. I want to get to one. This is probably one of the most interesting cases. Things are changing. I'm going to get this and then I'm going to go to another one. This is what I want to get to. Because how many heard Dr. Bryan yesterday? He said he goes all around the world talking about vascular elasticity and all that, and nobody cares until he starts talking about sexual dysfunction. Well, I took that to heart. So he was talking about opening up blood vessels for nitric oxide and helping with erectile dysfunction. Well, I'll tell you another thing you need to cure or to help erectile dysfunction is you need the parasympathetic nervous system. Because even though you open up the vessels, the parasympathetic, see, I always tell you I'm a basic kind of guy. And if you look at this, what controls erection? Beg your pardon? Oh. Yeah, it's the parasympathetic nervous system. So if and that's what Dr. Klenner, everybody's parasympathetic. The parasympathetic nervous system is the first to go. I'm going to talk about it in the next lecture. And when your body is worried about survival, it sacrifices the parasympathetic to make sure that the sympathetic is there to protect you. So the first thing to go is the parasympathetic nervous system, always. So the parasympathetic controls erection, and the sympathetic controls ejaculation. Most guys will have erectile dysfunction and premature ejaculation because they have overactivity of the sympathetic nervous system, underactivity of the parasympathetic nervous system. As you guys may know, a lot of times you get performance anxiety. Performance anxiety is because you're not relaxed enough in order for the parasympathetic to work. So I want to get to this one case where sometimes I work backwards. So I look at that graph, and I had a 21-year-old college student. He went to Vanderbilt. He went to my alma mater. And he was on antidepressants, and he had erectile dysfunction. This is a big, burly guy who, I didn't even test his testosterone. His testosterone should have been through the roof at 21. How can a 21-year-old have erectile dysfunction? 21-year-olds should have spontaneous erections 5 or 6 times a day, if we all remember 30, 40 years ago. But anyway, so I look at this, and I'll show you I'll show you a little bit later his HRV. So I look at his HRV. He's 21 years old. His total power is 300. I'll show you in a minute. And his parasympathetic nervous system is shot. Okay? So I give him amino acids, and I give him some herbs to increase the parasympathetic nervous system. Within a month, his erectile dysfunction is gone. And in 2 months, he's off his antidepressants. That's why I'm telling you, these kids who are trying to get in college and stuff, they're using up their heartbeats way too fast. There's no way a 21-year-old, and he said most of his friends in college are on antidepressants also. It's awful, okay? Now, I'll tell you, I had another guy who was on Viagra, and it wasn't working. Did the HRV, his parasympathetic was down, give him amino acids, give him the herbs to increase his parasympathetic nervous system. Now, all of a sudden, his Viagra works. Well, the Viagra really wasn't the problem. His problem was his parasympathetic nervous system. Okay? Now, then I said, wow, that's unusual. I said, I wonder if there's any literature about this. So then I went to this. This is in internal neurology, heart rate variability in men with erectile dysfunction. And it says, HRV patients with ED exhibited different HRV parameters compared with normal controls that suggest that patients with ED may have some kind of imbalance of the autonomic nervous system, and it may be possible that general imbalance of the autonomic nervous system is one of the causes of ED. Thus, HRV analysis may give valuable diagnostic information and serve as a rapid screening tool to evaluate altered autonomic nervous system. I couldn't believe it. Now, this next one says it should be a part of the workup. Our results indicate that it is essential to use test screening for autonomic dysfunction, as a sensory motor polyneuropathy may mostly be detected clinically. Nerve conduction stuff, I want to get down to the part. None of our patients with neurologic involvement would have been missed if pudendal SEP had not been performed. So they were saying that if you just test the autonomic nervous system, you really wouldn't even need any of these higher level tests. So erectile dysfunction, they're really saying HRV should be a part of the workup. This is the guy I'm talking to you about. His total power was 399. Now remember how that parasympathetic was, had those big mountains of power? This is a 21-year-old. Total power 399. Now this is 1 month after amino acid therapy. It's 947. He's starting to get some humps there. Starting to get a little parasympathetic erection right there. See that? So, all right. So amino acids. So now that's going to lead me into my next lecture. All right. Can you switch over to the next lecture for me? It's the fundamentals of brain health. I think he already had it. Have I seen it in women? Yeah, well, with women have to be relaxed in order to want to have sex. Men have sex in order to try to relax, okay? So if their parasympathetic nervous system is shot, they're not going to be relaxed enough to want to have sex. So you have to try and boost that system up in order for them to be relaxed enough to even think about it. Men, as you might know, they think about sex 24/7. Women, I tell men, when you're married and when you have children, that don't be offended, but sex is right below washing clothes. And see, women know. My wife is back there hiding, but she knows that. You want to do this? Well, I got to wash the clothes first and do this. Okay, all right. So anyway, yes. Postural tachycardia. It will. If a person has arrhythmia or this, it will show up in this test. It'll just make it look almost uninterpretable. So when I see it, I say, you need an EKG. Now, Dr. Clinton, see, now I don't do EKGs in my office, but when you see something weird here, you usually do an EKG on them. And usually you'll find something on EKG. Yeah, it makes it where it has all of these ectopic beats and all this. And so that's when you would go to to an EKG. All right. Yes. Yeah. See, now let me explain this to you guys. Yeah, AFib, and if they're on beta blockers, you can't really do it. Now, I'm going to tell you the difference between my practice and your practice. Some of you guys practice this. I don't see sick people. See, if you got AFib and congestive heart failure, you don't want to come to me, okay? You go to one of you guys. You go to Dr. Miner. We hand out your cards. AFib. I don't deal with POTS and all of that. Oh, that's what, I say the difference between what I do and what others do. Doctors are trained to identify, diagnose, and treat diseases, okay? And I was good at that. You guys are good at that, okay? But most people don't have a disease, okay? So if you don't have a disease, what do? Well, that's what we're trying to talk about here. This guy, erectile dysfunction, that's really not a disease. Yeah, that guy's 21. He really didn't have a disease. He had a functional problem. So, yeah, when you try to apply this to the disease patients, it doesn't work so great, okay? Now, after you get over the disease and you want to improve their function, because usually if they've had a disease, they've had sympathetic overload trying to handle that disease because that was a stress. And so then it sacrifices the parasympathetic trying to get through that stress. So now once you guys have taken care of the diseases, now you can start doing this stuff. So if you start asking me a bunch of questions about congestive heart failure and all of that stuff, I'll get one of you disease doctors to come up and y'all to talk about that stuff. So then you say after that's over, then you can use some of this stuff. Okay? All right, brain dysfunction is on the rise. And as you know, that's why if you look at that HRV, you'll be able to see that. 1 in 8 senior citizens develop Alzheimer's. 1 in 8 children are diagnosed with brain development disorders. Prevalence of dementia is reaching, I don't have to tell you all this stuff. Brain dysfunction is on the rise. Okay? What are the consequences? Decreased capacity to learn, decreased passion and motivation, lose ability to enjoy simple pleasures, lose taste and smell, which leads to inability to enjoy food, loss of ability to digest food, poor job performance, depression, and dependence upon others. Is there hope? That is my mother. Okay? My mother passed away in 2012. She's sitting behind in my office. And I'm going to tell you, I'm a little bit selfish. I got into hormones because I wanted to stay married to my wife. And then my mother developed Alzheimer's about 5 years before she passed away. And I got real interested in brain health because I was trying to think of what could I have done to help my mother. And so, this has gotten kind of personal to me. So I got really interested in brain health. So I have a sit behind. I got to take that off so I don't get emotional here. So I take that off because, Alzheimer's can be a very bad disease. But I was blessed that my mother didn't have it that bad. It wasn't like she would wander off or anything. She just forget things. In the current healthcare model, you have to wait until you cannot recognize your family members or find your way home before the doctor will diagnose you with Alzheimer's disease. Despite the fact that you notice your sense of direction and your memory are progressively deteriorating years before the diagnosis. So, I have her behind my desk because, when we first found this out, it really bothered us. I'm one of 6 kids, and I'm the youngest. And it really bothered us. We were like, oh, what's going to happen to Mom, what we're going to do. And we found that, losing her memory, the great thing about it is that every time she saw us, she was excited because she really had kind of forgotten how many children she had. And then I'd bring my kids over, and she's like, oh, you got kids? And then she'd come to my office, Eldred, you're a doctor? so my youngest daughter said, man, it must be cool to always be surprised with all of these great things that are happening, because every time we would come over, she was like, so she'd come to my office, God, you're a doctor, you got kids, you're married, oh, this is your wife. And so we were like, it doesn't bother her, why is it bothering us? So we learned to live with it. We learned to live with it. So it did spark my interest in Alzheimer's. So anyway, demise of the brain. What could cause the brain to demise? High carbohydrate diets. And then, I hate to say that when we got bagels back there, but it's hard to get a gluten-free menu here. But anyway, high carbohydrate diets. Processed foods laden with neurotoxins, brain sap, and bad fats. Common digestive problems can cause demise of the brain. We're going to talk about a lot of that today and tomorrow. How the brain and the gut problems will lead to brain problems, wheat and gluten foods, lack of sleep, and chronic stress. And that's, kind of my thing is that chronic stress thing. Weighing in at about 3 pounds, it is one of our heaviest organs and the most oxygen demanding, and it uses up to 30% of the body's glucose supply to function. So your brain needs oxygen and your brain needs glucose. And that's why if you lack oxygen or lack glucose, the first thing to get shut down is your brain. Okay, if you become hypoxic or you become hypoglycemic, what happens? You faint because the brain doesn't have enough energy to keep going. Yes?
The brain really doesn't need glucose.
It needs ketones. Yeah, I got you. Yeah, but
for most people who are living on a higher level of glucose,
yeah.
it's very sensitive.
Yeah, and I'm going to talk about too much or too little glucose can be much. Yeah, I said something yesterday. The brain loves ketones, and that's why in very low-calorie diets, it breaks down fats into ketones. It would much rather live off of ketones. You're exactly right. Okay, the brain and its functions. The frontal lobe, a healthy frontal lobe always allows us to function appropriately within society as it is involved in the ability to reason and suppress impulses. These impulses include acting on sexual desire, violent tendencies, other types of socially unacceptable behavior. If you disconnect your frontal lobe, this is what you will primarily do. You will be fearful, you will fight, you will feed, and you will fornicate. And that sounds like a little bit like our society. So we've got a lot of dysfunctioning frontal lobes. And that is also the first to go. You're talking about higher levels. That higher level, that executive functioning, is what is the first to go. Adults with impaired frontal cortex function also may struggle with impulse control. They are more likely to say things that they shouldn't, cheat in relationships because they cannot dampen their sexual impulses, or use bad judgment in business and personal matters. And I think sometimes that's what we like to see, because I have some guilty pleasures. I look at things like Scandal and Murder, She Wrote, and that's what they do. They make bad business decisions on impulses and sexual desire and all of that stuff. So I think somehow we're a little bit drawn to that type of primitive functioning. So the frontal lobe also governs emotion and drive, motivation and planning. Frontal lobe impairment can lead to an inability to set goals, to follow through on projects and plans, can no longer commit to anything. You may become lazy, unmotivated, and even depressed. In the field of neuroscience, depression is considered a frontal cortex impairment. So this is that front part of the brain is what gives you your motivation and everything. So that part. Lastly, your frontal lobe cortex is responsible for activating muscles. Impairment in the frontal cortex will result in reduced amplitude. It causes you to walk more slowly and all that, as people get older. And then one of the telltale signs is poor handwriting is one of the first things to go when the frontal lobe goes. Now, with us as physicians, you'll never know that your handwriting got bad because it's always been bad. So that's not a very diagnostic sign in physicians. Or maybe our frontal lobe got screwed up in medical school. So it's one of the two. Either it's not very diagnostic, or maybe it's very diagnostic. Who knows? All right. So frontal lobe symptoms. Decreased amplitude or slower movements in the muscle. That's more advanced. Depression, mental sluggishness, poor impulse control, poor social behavior and judgment, poor handwriting, poor cognitive functions such as math and planning skills, poor muscle coordination for learning such as dancing and playing sports. The temporal lobe is located on either side of the brain, and it is responsible for hearing, speech, and memory, emotion responses, and also distinguishing smells. I was looking at something. Oh, I know, it was like a couple of weeks ago. They were doing tests for Alzheimer's by holding something, and they had a ruler. Did you see that? And it was peanut butter. And how far away could you still smell the peanut butter? And they were using that as an early sign for Alzheimer's, because Alzheimer's problems take place in the temporal lobe, and distinguishing smells is one of those first signs that you get. So they were discussing whether or not that was a significant diagnostic tool or not. But this is all trying to test temporal lobe function. Within the temporal lobes, you also have a very important area called the hippocampus. This is the area of the brain that's involved in learning and memory. The degeneration of the hippocampus is what leads to the Alzheimer's, and it also is what converts short-term into long-term memory. It's also involved in the circadian rhythm, and that's what we're doing when you see those cortisol tests. And when you screw up the circadian rhythm, it's telling you that the hippocampus is starting to fail. And it's responsible for healthy energy in the morning, high cortisol in the morning, and low cortisol in the evening. So dysfunction in this area can lead to insomnia and inability to get out of bed in the morning, and afternoon crashes in energy. So again, if you see an abnormal cortisol curve, those guys are at risk of developing Alzheimer's disease because they have a problem in the hippocampus and in the temporal lobe. The parietal lobe perceives sensations as touch. I really want to just talk about the frontal lobe and the temporal lobe. The parietal lobe, the occipital lobe, I have it in here, but the important parts is, and what you'll see on some of these tests that I show you, is that those are where the big problems are. The executive function and the hippocampus. Because most of the time when you're talking about the occipital lobe and the parietal lobe, usually that's due to some kind of injury or something, some type of trauma, concussion, or whatever. But the frontal lobe and the temporal lobe, it doesn't necessarily have to be a brain trauma. It can be from all these other things, too much stress, inflammation, not enough amino acids. So I want to try and make sure I hit the high points since I started with that other one. The occipital lobe, we know all about that. When the brain is operating optimally, normal brain output generates a parasympathetic response while at the same time dampening the sympathetic system. We talked about that. And the parasympathetic, more than 90% of brain function is used by the parasympathetic nervous system. Brain deterioration is first seen in this portion of the autonomic nervous system. The inability to rest and digest are the first signs of brain dysfunction. How many people who see functional medicine patients that would you say, what percentage say they have problems sleeping? Like 99.9%. And how many of them do you think have gut issues? All of them. So, you can see the numbers, you can see the tests, but we see it clinically. This just allows you to look at it objectively. And remember, you cannot manage what you cannot measure. So this is a quick measurement to show where the problem is. And I'm going to tell you, the patients love it. When they say they can't sleep and people have been giving them sleeping pills or whatever, and you explain this to them and they see that flat parasympathetic and you say, this is your problem, they are so thankful that somebody can tell them what the problem is. And then you say, hey, here's how we build up this side of that little hump there. And you do it, and then they come back and they see it improving, and they're sleeping, they're eternally grateful to you. That's a little bit out of place. So 6 keys to brain health. You have to have balanced glucose. You're exactly right. Too much glucose or too little glucose, both are a problem. And too much may be more of a problem than too little. Okay? You have to have adequate oxygen. You have to have essential fats and phospholipids. You have to have amino acids and intelligent nutrients that make acetylcholine or help you to make acetylcholine because that's the learning neurotransmitter. You have to move voluntarily. I'll show you a study where if you made animals move, it didn't improve brain function. If you voluntarily do it, so your attitude when you exercise is as important as what you do. Decrease stress, especially inflammation, and increase something, this SIRT3 is what I was talking about yesterday. It actually increases plasticity, and I'll show you how you increase that. So those are the 6 keys to brain health, and we're going to quickly talk about all of those. Principle of the brain, are the neurons receiving enough oxygen, glucose, and stimulation? Are blood sugar issues, poor liver function, inflammation, hormonal imbalances, or lack of neurotransmitter activity? As Dr. Zabra was talking about yesterday, if your hormones are out of balance, you're not going to make enough GABA. That's why a lot of PMS and people who are postmenopausal, they have a problem with anxiety and relaxation because they don't have progesterone making GABA, which is one of those calming neurotransmitters. Hormone imbalance or lack of neurotransmitter activity promoting brain degeneration. Is plasticity, the ability of the brain to learn and adapt to change, being promoted in a positive or negative direction? Low blood sugar promotes surges of adrenal fight-or-flight hormones, epinephrine and norepinephrine, which is stimulating. We all know that somebody who takes insulin and then they don't eat, they get anxious because the sympathetic nervous system is saying, your blood sugar is too low, your blood sugar is too low. And then you eat something, drink the orange juice or whatever, and everything calms down because now the sympathetic nervous system has alerted you, you've done something about it, now the parasympathetic nervous system kicks in and calms you down. High blood sugar promotes surges of serotonin and GABA, which make you sleepy after you eat. The surge of serotonin is also why sweets and carbs are comfort foods. Okay, so you increase your insulin, and it increases serotonin and GABA, and you feel better. As tryptophan and other branch-chain amino acids line up for this large neutral amino acid transporter, so it's like all these amino acids get on a bus and they go to the brain. The surge of excess insulin makes it overzealous at its job. It refuses entry to almost all other branch-chain amino acids, sending them into other tissues. As a result, the bus is overcrowded with tryptophan. And once all the tryptophan gets in the brain, it makes you sleepy and drowsy and whatever. So how many people use 5-HTP to increase serotonin? If you, now what happens is the same thing can happen if you use 5-HTP. If you use too much of one amino acid, it overcrowds the bus, and it makes you deficient in the other amino acids that need to get on the bus, like phenylalanine and tyrosine and all of those things. So if you use 5-HTP, you need to use it for a short amount of time to increase the serotonin, maybe for a month, 2 months, or 3 months. And then you need to give them all of the amino acids so that you make sure you haven't depleted their other amino acids. I have started using 5-HTP a little bit less and giving all the amino acids and let the brain figure out who needs to get on the bus. I'll use it for a short amount of time, but I don't use it more than a couple of months. And usually I'll use 5-HTP along with some other things. Okay? High amounts of the same neurotransmitter, in this case serotonin, consistently bombard the neurons lose their sensitivity to it so that it is less effective over time. Just like anything else, you get downregulation. So if you use 5-HTP for too long, it's not going to work as well as you continue to do it. This is because various other cofactors are required for serotonin synthesis also. Also, what you'll start to do is use up your methyl donors and your B vitamins. If you look at the pathway of 5-HTP to serotonin, it uses B vitamins in order to make that conversion. And so that's also why when you eat a high carbohydrate diet, because that's increasing your serotonin. Most of the time when you have a high carbohydrate diet, you will develop a B vitamin deficiency if you don't supplement with B vitamins. And I'll tell you another thing is, if you raw sugar and sugar cane comes with B vitamins already in it. Okay? God knew that if you eat sugar, that you're going to need B vitamins, you're going to use up your B vitamins. So raw sugar kind of compensates for that use of B vitamins in order to process it. The deleterious effects of sugar and insulin surges on the brain are so well known that many have developed Alzheimer's disease as a type 3 diabetes. In addition to the inflammation-promoting properties of insulin, the excess abdominal fat, insulin surges, reduce the brain's ability to clear out amyloid plaques. So you're talking about, hey, glucose is not so great for the brain. It's not, because you have too much glucose, it begins to glycosylate different proteins. And so, yeah, as we all know, sugar is not good for you. How do you increase oxygen to the brain? Nitric oxide. No way am I going to sit up here today and try and say anything about nitric oxide after Dr. Bryan said. So what he said yesterday, yes, that's how you get oxygen to the brain, okay? So it's embarrassing. I will never say anything about it. Okay, so anybody read this book? No More Heart Disease. Probably I told you. This is the guy who won that Nobel Prize that Dr. Bryan was talking about yesterday. It's a great book. And when I see a poor digital pulse analysis, which I'll show you, I get them to tell them to read that book, because nitric oxide can reverse heart disease, just all the stuff that Dr. Bryan said yesterday. This is what this book is talking about, and this is how this guy won that Nobel Prize.
This guy thinks it's the arginine pathway.
Yeah, he thinks it's the arginine. Now, Dr. Bryan is talking about, hey, if you don't have that enzyme, then you definitely need to have straight arginine. But you have to have more than arginine. But arginine does work in a majority of people. So, but now this is we do something. How many people do a digital pulse analysis? It's a cool thing, isn't it, Dr. Miner? He has his own little. Oh, I told you I'm not talking about sick people. His AFib, he must have an AFib clinic down there. Is that what it? So, but this is a digital pulse analysis, quick. This is a quick in-office screening test looking for arterial sclerosis. And the easiest way I can explain this, and this is how I explain it to patients, is that if you're on the beach and you see a big wave out in the ocean, and as long as there's no hurricane warnings out or whatever, you don't worry about that big wave coming and washing you away, because you know that wave is going to end up being a ripple by the time it gets to the shore. Okay, that's because the ocean is wide and expansive. That energy that's in that wave is going to dissipate over the whole ocean. And so by the time it comes there, it's just a little bitty wave. Now, if you're in Colorado and you're whitewater rafting and you see waves coming towards you and there's mountains on each side, that energy has nowhere to go, and that's why you can whitewater raft, because those waves are going to have the same intensity. So I can be at the end of a water system, and if I see a big wave coming toward me, when I know it started off as a big wave up there, if I see a big wave coming toward me, I know it came through a constricted system. If I see a small wave coming toward me, when I know it originated as a big wave, then I know that it's a wide open system. All right? So now this is how this works. The heart generates a big wave, and that big wave of blood goes through the aorta. And the aorta has to open up a little bit to decrease the pressure so they can go down smaller vessels. Then those have to open up a little bit so it can go down other smaller vessels, so that by the time it gets here, it's just a little bitty wave that started out as a big wave up here. So you want your wave to look like an ocean. You want it to be big up here and small down here. So this is how this looks. This is the wave coming out of the heart. Whoosh, big wave. This is how much energy gets taken away because the vessels are wide open and elastic and have a lot of nitric oxide. And then this is the little wave coming toward me on the beach. All right? But let me point both ways. This is wave coming out of the heart. This is the energy being taken away. And then this is the wave coming toward me at the beach. All right? Now, as the vessels become more constricted and more like Colorado and whitewater rafting, then the wave coming toward me gets bigger and bigger. That second wave gets bigger and bigger, the stiffer the vessels become. Okay? This is a 2 or 3 minute test in the office that you can do, and if you use arginine or if you're going to use something that increases nitric oxide, then you will see that this can reverse, just like in the No More Heart Disease. It can be reversed. Arteriosclerosis can get better. And I'll tell you another thing what you'll see, because we do it upper and lower. If someone has had an injury, a broken foot or a broken leg or a broken arm, you will see that their digital pulse analysis in that area won't be as good as in the other area, because that injury has healed up with scarring, and so it made the vessels not as elastic. So it doesn't necessarily always mean heart disease. It just means there is some stiffening of some vessels somewhere. So if I see a young person, I see one looks worse than the other, I say, hey, you ever broken your leg? You'll be surprised at how many times they'll say, yeah, I had an injury in that area. But this is a nice, cool little test, and it's primarily looking at these smaller vessels. And those are the smaller vessels that get occluded when you have a stroke. So we're talking about getting enough oxygen to the brain. A lot of times we look at this and we're looking at heart disease, but in that book he's talking about heart disease and stroke, because you want those small vessels to be elastic. And another thing that he was talking about when he was talking about looking at brachial pressure, occluding that's another test you can do in the office called an endopat test, where you occlude the brachial artery, and what you want to see is that if you decrease blood flow to an area, will you get a compensatory expansion of the diameter of the vessel after it has been occluded? Because that's what should happen if you get a minor TIA or whatever. Then after that occlusion has been removed, you should see a compensatory increase in the diameter of the vessel to try and catch up with the oxygen deficit. Yes, sir. And then, usually I'm doing these, I do these tests on everybody. So yeah, I would have my HRV and my DPA, and we could say, yeah, maybe one is causing the other, and yeah, it can be spasm. But usually you're doing this over a long enough period of time, because I think it's like a 3 or 4 minute test. So, and then, sometimes when it doesn't, well, let me take that back. It can definitely be due to spasm, because if someone comes in and they have had coffee or an espresso or whatever, they come in and do it, it'll look awful. And sometimes when it doesn't match, I got a 30-year-old that has an awful DPA, I ask them, have you had coffee? And sometimes they'll say, yeah, I had a double espresso before I came in. So you're exactly right. So you have to ask those questions. Well, maybe you got AFib and you need to see a doctor. If it doesn't work, it's AFib, okay? All right. So, nitric oxide also helps preserve the elasticity of all the vessels because it is signaling molecule. Again, let me just skip over the nitric oxide stuff. I feel embarrassed to sitting up here. That guy has spent, I said, man, how you know? He said, I spent 15 years looking at nitric oxide. I'm like, okay, I'm glad better you than me. But anyway, so gut-brain. The gut-brain axis suffers from brain degeneration. Specifically, I know that I saw that this morning. I misspelled Vegas. So I must have been thinking about where I want to go after I get out of this conference. And I didn't even spell Vegas. That's not correct either, but I don't know where that came from. Leaky gut leads to total body inflammation. Because the GI mucosal lining nor the brain have pain fibers, GI and brain inflammation do not produce pain. So that's the problem. That's why they don't know that their gut is inflamed, and they don't know that their brain is inflamed because it doesn't cause pain. By the time you have pain in your gut, there's serious issues. Okay, I want to get to this. Brain inflammation slows the transmission of information from one neuron to the other, resulting in brain fog. So brain fog is really a sign of brain inflammation. It's not headaches. Headaches is not a sign of brain inflammation. It's more brain fog because it slows down transmission between one neuron and the other. Now, we got a lot of people who are going to talk about Dr. O'Brien, who is an expert at looking at gluten and leaky gut, and Dr. Fresco. So I'm just touching the surface. You're going to get the details about this. But you can test for leaky gut. We got people talking about tests. You look at zonulin and actinomycin and lipopolysaccharides. Dr. Fresco is going to talk about that. But these are all tests you can do to see if there's gut inflammation, gut and brain inflammation, because, again, pain is not going to be one of the symptoms. So causes of breakdown of the blood-brain barrier: chronic stress, alcohol, elevated glucose and diabetes, chronic environmental toxic exposure, like Dr. Shaw was talking about yesterday, elevated homocysteine with B vitamin deficiency, poor diet and antioxidant status, and systemic inflammation. If you get inflammation from some other area, it's going to eventually lead to a blood-brain barrier breakdown. That's why your brain kind of has some brain fog no matter what kind of illness you have. I mean, you have a cold and your brain doesn't work well. You have any kind of inflammation, any kind of systemic inflammation, you're going to have problems with brain fog. So there are 10 glial cells for every neuron. So your brain is very involved in the immune system. 50% of the brain by weight is glial cells. Glial cells dispose of dead neurons, beta amyloid, and other cellular debris. Overactivation of glial cells caused by inflammation hinders transmission speed and conductivity of neurons. Neuroinflammation also shuts down energy production in the brain cells, leading to mental fatigue and possibly depression. So a lot of depression may be due to inflammation. What can cause overactivation of the glial cells? GMO, inflammatory foods. Again, really the next 2 days we're going to talk a lot about food sensitivities and how that affects the brain. And so you'll get more about that. I'm just trying to show you what's going on. So dampening inflammation is very important. These are some herbs and some substances, natural substances, that can be anti-inflammatory. Some of you may have seen curcumin, resveratrol, all of those things can be helpful. This is a long slide, but this is what I tell you. When systemic inflammation can affect the brain, but if the brain is inflamed, it can cause inflammation in the body. So it's a back and forth type of thing. For example, a person who sustains a head injury suddenly develops an autoimmune disease, or a problem in brain function sparks multiple food intolerance. When brain injury or impairment triggers an inflammatory response in the body, is known as brain immune dysregulation disorder. So brain inflammation or brain trauma can cause systemic inflammation. Systemic inflammation can cause brain dysfunction. I'm going to move on with that. So I'm running short of time. I want to show you this test. This is a test Evoke. This is a kind of expensive test, but it's a cool thing to show you what I'm talking about. You can do an in-office little EEG type of thing. And it'll show you, it really is an EEG. You can bill for it as an EEG. But what it does is it shows you brain activity. It can show you how fast or how slow neurons are transmitting information. So it's good looking at brain inflammation. So you can't see this, but This should mostly be green. This is looking at different wavelengths and different, I'm not a neurologist, but I can show you in pictures. It should be green, okay? Red is overactivity. Blue is cool, is underactivity, okay? So what does inflammation do? It causes neuron transmission to slow down. It's called an evoke because it looks at evoked potentials. It stimulates hearing and it stimulates brain with these little flashing checkerboards or whatever, and it sees how long does it take for you to see a stimulus for it to evoke a response, and how do you respond to it. So it's sensory input down here. See, sensory input. Attention, how quickly does your brain recognize it, and then how fast does it do whatever it's supposed to do. Because what it says is if you see a big checkerboard, you click. If it's a small checkerboard, you don't click. And if you hear a whooshing sound, you click, or if you hear a beep, you don't click. It's one of those things. So you have to hear or see something, and then you have to know what to do afterwards, okay? So that's a part of it. So these two down here, this looks at attention. So this is how you would really look for ADD, even though, ADD is just a description. But this is having a problem with paying attention, like recognizing whatever it's supposed to be, this right here. And this is looking at how quickly do you put it short-term memory into your long-term memory. It should look like this. It should have a hump and then it should go down. It shouldn't stretch out like this. It should go up and down quickly. And this means when it's red that they have a process in that processing. They have a problem in processing information, attention, and in working memory. And that's primarily acetylcholine. This is a food sensitivity test. This person had a huge amount of food sensitivities, a lot of inflammation, had to give her IV vitamin C. We had on these anti-inflammatory herbs. This is not the same. This is the same person. These are all the foods that she was sensitive to. Tried to fix her gut and all that stuff. It's causing problems with information processing. And look at the blue in that brain. See how so this is just a visual representation of how inflammation slows down brain function. Okay. Now, this is changes after removing foods and giving IV nutrients once a week. We're giving once a week. And you can see the green says that that's where her improvement was. We still have a long, and this was about 6 months ago. She's probably even better now. But her decision-making speed went up by 33%, and her reaction time went up by 19%. Let me show you one other example. This is another. She has some overactivity. She actually has some brain injury here, but then you still see there's some blue. She also has an inflamed brain, but hers was primarily due to the fact that her dad he owned a paint factory. So she grew up around this paint factory, and she has problem with obesity, and it's real issues. But anyway, we did IV detoxification with her. All those areas in the green there, it's kind of off-center there. But she improved in multiple areas by giving IV detoxification. Liver and brain detoxification are different. Compounds we use to support liver detoxification are not really effective for brain detoxification because they cannot cross the blood-brain barrier. The key to supporting healthy brain detoxification is to prevent and manage inflammation in the brain. EFAs, you have to have good fats. I got to get through this pretty quickly. So also you have to have neurotransmitters. When you have a low total power, you need to give amino acids. We raise the total power by giving amino acids because most people are deficient in neurotransmitters because neurotransmitters are made from proteins, and proteins are made from amino acids. Now, Dr. Brown was also talking about proton pump inhibitors. When you take proton pump inhibitors, our stomach acid goes down just with age. But if you add proton pump inhibitors, acid is essential for the breakdown of proteins. If you don't have stomach acid, you will not break down proteins into amino acids. And half the population is on proton pump inhibitors, so they can't break down proteins into amino acids. And if you don't have amino acids, you can't make neurotransmitters. Okay, so you give amino acids to bypass that, and that's how you increase total power. Inflammation hormone imbalances. I'm really running out of time. Yeah, here it is. Hydrochloric acid breaks down proteins into amino acids and also kills microbes. And we also learned yesterday it makes it where you can't make nitric oxide. You need all of these things in order to break down proteins into amino acids. You need copper, vitamin C, folate, B2. All of these are necessary, and most people are deficient in it. And if you look at body composition analysis, you'll see the muscle mass is down. You do HRVs, you'll see most people have total power that are down because they don't have all of these nutrients to break down proteins into amino acids. That's why almost all of my patients are on amino acids. And it's not because I'm just giving to it, it's because that's what we see in the test, that they almost all need amino acids. This is a 21-year-old girl who had to drop out of school. This is not the person I'm talking about yesterday, but I was telling her about it. But anyway, this is a lady who had dropped out of school. She was 21. She was having some emotional issues with her boyfriend. Her total power is 210, 21-year-old. After amino acid therapy, this is about 3 months of amino acids, her total power is 2,000. So it works, and you have an objective test to do it. One other test I want to show you, and then I'm going to stop. Because I'm in that you cannot manage what you cannot measure. So this is a way to measure brain function. Let me show you another way that I love to do. Dr. Zava talked about GABA. Show you this one other test. Then I'm going to stop. Homotropic modulation. Man, I didn't know I had these many slides. Acetylcholine. This is how you learn. This is why, I'm talking about Alzheimer's. I'm thinking about my mother and, whatever. Is acetylcholine. Impairment of acetylcholine is the earliest sign of Alzheimer's disease. You lose photographic and verbal memory, converts short-term to long-term memory in the hippocampus. So you want to do things to increase acetylcholine. This is a sign that you have problems with short-term and long-term memory. Acetylcholine receptors do not become resistant to repeated exposure. There's no homotrophic modulation. Give too much serotonin, you downregulate it. God must have known that you can't learn enough or whatever, so he said, hey, you can have all the acetylcholine in the world, and I'm never going to downregulate it. Okay, so whatever you can do to increase acetylcholine, you want to do it. Foods rich in choline. I missed my L. This is a new slide. It's a new presentation, so I see all my errors when I get up here. I don't see it when I'm looking at it. Foods rich in choline, not choline, is liver, organ meats, egg yolk, beef tofu, cream, milk, fat. I'll show you something else here. Lecithin and herpesine is derived from club moss. These are two things, alpha-GPC and L-herpesine A. A lot of information about those two and increasing acetylcholine. Shucks, let me go back. This is a scientific review looking at promising therapeutics with natural bioactive compounds for improving learning and memory, a review of randomized trials. And what I have here, that circle, there's about 5 articles talking about herpesine A and how it improves memory and cognition. So alpha-GPC and herpesine A are probably the most well-studied, and they increase acetylcholine. There's a lot of others, and they work better in combination than they do really by themselves. So choline, D-L-phosphatidylcholine, you can talk to me afterwards. Send me. We use something called lipid exchange, where we use phosphatidylcholine and glutathione. Phosphatidylcholine, we mix it with 3 cc's of red blood cells, and we give it back to them, and it brings choline into the brain. And also it's followed with glutathione because you're trying to get those fat-soluble toxins out of the brain. So the phosphatidylcholine seems to push those fat-soluble toxins out, and then you need glutathione in order to detoxify them. Glutathione is an antioxidant and is a safe chelator. Glutathione as a chelator can bind environmental compounds and help remove them from the body. So we push those compounds out with the phosphatidylcholine so that the body can make acetylcholine so it can think again, and then the glutathione gets rid of it. Glutathione is very important for the brain. It helps in synthesis and protection and repair of DNA. The synthesis of protein. It helps to transport amino acids. the metabolism of toxins and carcinogens, the activation of enzymes, and the elimination of damaging heavy metals. This is a book talking about glutathione in the nervous system. It's a 600-page book. I haven't read it. I just want to show you that glutathione is very important in the brain. Maybe we'll get this guy to come next year. This is a CNS-VS. This is another, I love in-office tests that tell me things. This is a CNS-VS, and I'm going to finish here. CNS-VS looks at executive function in the brain. It's really testing the frontal lobe. It's a computer test that patients take for 30 minutes in the office, and it looks for verbal memory, visual memory, psychomotor speed, complex attention, cognitive flexibility, processing speed, executive function, simple attention, and motor speed. So you can't see it, but they have above average, average, low, and very low. And when I see people who are in this low and very low, and even low average and high functioning people, we do that lipid exchange. We give them glutathione, and then we give them these herbs, the herpesine A, the GPC. We also give them something to decrease inflammation, and we give them amino acids. And you do all of those. We do the lipid exchange once a week for 6 weeks, and we put them on this other therapy that they do in between. And what you will see is CNS before, and now all of hers are average. She only has one low average. Patients love it. I had a patient a month ago or 2 months ago who was studying for a PhD, and she said, I can't process the information and put it down on paper to get my papers done. Did this for about 2 or 3 weeks. She's back. She's saying, I'm doing my papers. I'm doing all this. This stuff works tremendously well. You use it in your office. You use the lipid exchange and all that stuff. This is another before and after CNS test. You see a lot of low, and you can't see the very low down. She has 2 or 3 very lows down there. And afterwards, all of them in low, average, and average. Yes?